and welcome to Health Show with Amara. As you know, in this show, we talk about health and health-related matters. Today, however, we decided to do something different. And what we planned was to bring in an NHS consultant who, after serving in his clinical role, has now paved his way into realms of leadership in this field. It's important because not only our younger generation, but also those who have been doing the clinical work for a long time may want to know how to find their way into the leadership roles working within the healthcare system. And therefore, we just hope that this session is going to be helpful for a lot of people. So today we welcome Dr. Khalid Aziz, who is not only a very successful psychiatrist, but also he's a medical director for a very big trust in London. So after working for 20 years, when he moved from Karachi, Pakistan to UK, he worked in London for 20 years as a clinician and then decided to change his career path and became a leader within NHS. So let's welcome Dr. Khalid Aziz. Hello, Dr. Aziz. Thank you so much for coming today. And we appreciate your valuable time to spare to participate in this show.
Thank you very much for having me today. It's great to be on Quews and such a humbled by the introduction that you've made. Really, the journey is been very long, but obviously happy to share the experience if it matters and helps.
Absolutely,
others.
Absolutely. Our viewers would want to know all about your journey starting from Pakistan to UK and now.
Yeah, God, that is a very long journey, spreading over 30 odd years. So I graduated from local medical college in Karachi and then came to UK in 1996. And obviously, once you come here, you have to do the qualification conversion exam, PLAB, etc. Took a little bit of time in getting through that, quite a challenging time. But the aim and vision was there, that what you need to do and what you need to get to. So that helped alongside the support and help that I had around me. And worked initially in a couple of general medicine specialties in a job until I took myself to where my kind of career trajectory, which I thought lies, and where my passion is to get into mental health and psychiatry. So I got into training scheme in London through the training scheme, and then going up the ladder through that, and got into a job working as a psychiatrist and consultant. Consultant first, I worked roughly around 10 years. And obviously, as a clinician, you always have a lot to give, not just to your patients, not just to their carers, not just to the societies, also to the wider team as well. I mean, it is built in our training to train others as well. So there's a lot of trainees have come through and gone, and they have now progressed in their career as well. But there came a point where I thought that, have I got more to give in terms of my knowledge, expertise, skills that I have developed over the years, and can I create a legacy that can help people to grow further, especially for South Asian background clinicians who at times do tend to shy away from these leadership roles and management roles as well. So what is more there for me to do? So hence I decided to take that challenge a few years back.
Excellent. I mean, the thing is, we all know that when you take up this profession as doctors, our leadership skills are tested on day-to-day basis because we have to make decisions that could be clinical and non-clinical every day, prioritizing tasks and all that. But it's also true that not all clinicians actually are successful in reaching to the top, like you have in the leadership role. I'm sure it was very competitive for you to get into this position. Do you think you had to work extra hard to get to this level?
So one of the things that when I was reading through leadership models, training, literature, you have to do a lot of research in terms of, is it something for you? And do you really want to get onto this ladder and then climb that, what we call is corporate ladder as well, and get to a point where you set your trajectory to? So there was one very good quotation that I came across, is that you must allow yourself to grow as a wildflower in many places, because you thought, and many other around you may have thought, that you wouldn't. But it is about taking up the opportunities and the challenge that are available to you. Any opportunity or challenge in this career progression is hard work. It requires commitment, it requires dedication, and above all, time that you have to sort of dedicate to do these jobs as well. So you have to balance very carefully, think very carefully, balance your carefully before you take those decisions. So hence, I decided that I need to take decision. It is a reality that people from somebody like me, from my background, may have to work twice as hard to get to those points, because some of the things may not necessarily be in our fabric of communication, or perhaps in our training, because we tend to, we have grown up with this idea, is that we are clinicians, our job is just to treat patients. But we also need to think as a clinician, our job is also about managing those services that treats that patients and provide that services. Can we bring a real change that delivers that service more effectively, more efficiently, that people benefit more from? That only can happen if someone like me, you, and others follow this course and come into the system to bring that change.
But would you agree that you have to have an aptitude for this kind of a non-clinical role, even though we say that as doctors we could be born leaders, but still there has to be an aptitude, because sometimes, it may take away your role as a clinician, because you have to attend meetings. It's a corporate kind of a job which is not necessarily clinical. So do you think you miss not doing that kind of clinical work in your current role as a leader?
See, my view is that every doctor is a leader. It's built in our training, because we have been right from the day one, if I use the medical terminology, to think outside the box. We see people who come to us with symptoms and signs, although we are doing the investigation examination to arrive at a diagnosis, but we always had what we call as a differential diagnosis. We always have, it's not necessarily concrete one thing, but there's many other things could be causing this. And that aptitude is there. It's about utilizing it effectively and meaningfully. The second bit is that what you just asked is that how does one manage this? Because there's a different kind of meetings. Rather than you having your clinical meetings, your multidisciplinary team meetings, your patient-centered care meetings, which are more clinically led, more clinically focused, or governance meetings, more so clinical governance. Corporate meetings are very different to that, but it's about services structure, service delivery, outcomes, measures, and performance. But all those factors are very, very crucial. And it needs to have a clinician's involvement into that, because those clinicians are the grassroots of that service, who not just understand the need, are also able to articulate better that what real needs are, what challenges are, or how we can work more innovatively and effectively around it. So yes, I do have to adapt to the corporate functioning and corporate meetings as well. But again, the thought and the ambition was always that what's good for the service and what's good for the patients as well. So bear that thought in mind. Aptitude is there. It's just testing it and utilizing it. We just have to carve our way ourselves and our way into this as well. And for that, there's a lot of help and support and programs available as well.
Would you agree that it needs a lot of patience, tolerance, and flexibility? Because when you're working as a leader, you have to take a team with you, and you can't be doing anything on your own. You have to listen to a lot of people, and I'm sure you do come across a lot of conflicts and difference of opinion. And in order to tackle with that, what do you think should be the qualities of a leader to be able to do a good job or a satisfactory job?
See, it's important to recognize the difference between the management and the leadership. Two completely different things. As a leader, it's not about me, it's not about you. It's about the people in your team who you take together to make the difference. And the big difference is that management has a cognitive intelligence, whereas leadership has an emotional intelligence. Management is very transactional, whereas leadership is transformational. Management is about get things right. Leadership is about doing things right in the right way. Management instructs, but leadership enables, empowers, lead, and pull people to do things. So those are the kind of things that you need to understand. So if there's always going to be an overlap. There are times when you have to instruct people. There are times when you have to get things done as well. But there's, again, with the wider and greater benefit of the service and the patients has to be bear in mind as well. So one has to be clear in that first to begin with. Then you need to think of that commitment, challenges, and changes in the corporate functions. Because we need to realize is that not all corporate managers within the health sector are clinicians. They do speak a very different language. They do interpret and expect things differently to how we interpret it differently. So there is always going to be a tension or a conflict as well. But the leadership is about managing that conflict, managing that tension, and coming to a reasonable conclusion that works better for the service and the patients.
As clinician, you would, I hope you agree with what most clinicians think, that the model of most of the trust has now changed over the years. The working setup is completely different, and it seems like we are working in a more corporate business unit rather than a hospital, which is all about care of the patients, even though most of the decisions, they are basically about patient care. But it's all about, in addition to that, it's management wants us to generate money. So as clinicians, we are not taught to think about money or finances or to benefit from the money aspect of things. Do you think it is hard for us as clinicians to find what is best for the patients clinically versus what management wants us to do to save money? Do you think it is a very challenging part of your job as a leader?
It's interesting you say that, but I think I'm going to have to slightly digress and then come back to it. Whilst doing my leadership models and reading, as we all do, I came across a quote which appears to be from Nelson Mandela. So he talks about vision and action. So he says, actions without vision is just time passing, and vision without actions is daydreaming. You combine the both, you bring the change to the world. So if you narrow it down to where you're working, so action and visions are very, very important. Unless you have that vision and you translate them into action, only then you work towards what you need to work. Corporate way of functioning is yes, it's very directorial, as I said, very transactional earlier on, and it expects results which in general term were referred as KPIs, key performance indicators. But how does a leader seize those KPIs? What does new leadership think of those KPIs? Because it's about business model, saving, generating money, but at the same time deliver an excellent care as well. How does one draw that balance? So as a leader, I say to people is that you need to think differently about KPI. The kind of initials remains the same, KPI, key performance indicator, but think it differently. Are you keeping people involved? That's a different way of KPI. Are you keeping people interested? are you keeping people inspired? Unless you do those three things, you never achieved those KPIs. It's very, very important that how you phrase the term KPIs. If you have people who are interested, inspired, involved, they will deliver the results. And that's what the leadership is about. And that's where the mismatch can be addressed.
Fantastic. But if we look at the recent years, and more so since COVID pandemic, the way most of the NHS trusts are working, there is a lot of struggle going on. The working setup is not the same as it used to be before COVID. So some people believe that COVID has resulted in all the destruction within NHS. Some think that it was inevitable whether or not a COVID pandemic would have happened. So what do you think about that? Do you think that there were some problem with the policies within NHS that was leading it into this kind of a situation that we are in as clinicians, facing challenges all the time? What are your views on that?
Okay. So we can blame COVID for many things, good or bad. There's a lot of good that we learned from pandemic as well. And there's a lot of bad that has come off as well, especially the impact on people's personal life and their professional life as well. But you don't get to a point where, unfortunately, we are just over 1 or 2 years. So if there is no forward thinking or foresight or planning, then we get to a situation where we are in the NHS. See, again, applying the clinical analogy is that if you get to a complicated stage of an illness, you don't get to that over one day. There are always signs and symptoms where there was an early prodrome, as we call it, then the acute symptoms, then the signs that are showing over a number of months or years, which gets to a point or leads to a point where you face up with a complicated situation. And then you feel rather helpless. Then what do we do? It's very challenging, okay? That's the same thing with any sector. And that's the sad reality in the NHS is that we may not have been able to pick up those early signs and symptoms of the deteriorating workforce, that what's going to happen and what can happen. What's our throughput? What's demand and supply, as we call it? Is that what's going to be our demand now and futuristic demand, and what's in the supply chain? How many doctors, nurses, paramedics, care assistants are coming through those that will they fulfill our need for now and future? I think there was probably some oversight on that planning, because we often are more reactive to the situation than responsive. Responsiveness says that pick up early, plan ahead so that to deal with the future as well. And it's right that as much as it lies at the ground level, somebody like me, as a medical director or leader, I need to know what my workforce is, who is where and what stage they are, okay? How many are retiring in the next 3 years? How many, as we call it, you probably understand it, but the specialist trainee coming our way, which we call ST4 to 6, coming our way. At what point they are completing their, as we call, certificate of completion of the certificate of training, CCT. So you need to keep those trajectories in mind as well, that how your workforce is, and of them, how many would be willing to take up those positions in the way that the current workforce working, because not everyone now wants to work full time. People wants to work in hybrid way as well. So we need to adapt to those needs. How do we adapt services to those needs as well? So there's a lot of thinking that is needed in that. Unfortunately, we didn't. We were more reactive rather than responsive to the situation. Hence, we are in the position. It does lie, then it lies with the policymakers as well. And that's where progression into a leadership career, or perhaps simple management career for people with ethnic background and clinicians, is very, very important, because you need to progress to that stage as well, where you can give the right advice. I'm not saying that they're not giving the right advice, but give the right advice, the right evidence in the right form for them to plan the way services should be structured now and for future.
So am I right in understanding that there were some failures on somebody's part or an oversight that the problem is coming? We didn't plan ahead, and especially when COVID happened, we were thrown into the deep end without any forward planning. So where does the failure lie? Do you think it's within the trust or it's at a higher government level?
I think, as I said, it's not something that you can single out one thing. It's a collective thing, because who holds the local knowledge and who holds the overall knowledge. How it's all fed back. It's a two-way process, top to bottom, bottom to up. I think the from bottom up approach is much better, because people hold a lot of knowledge and expertise in this in terms of advising, and this is where we are. So it's a two-way process. I mean, things change, government change, agenda change, I mean, manifesto change and all those things, etc. That have impacts as well, because some of the things that get laid in one manifesto of the government carry forward for another 5-10 years, but suddenly they get changed. Then you have to restart again and change again. There is an overlap, and then there's a gap, and then things slip out of the net, and then we find ourselves in a very different position. So it's just about structuring that planning into it and keeping if one needs to keep the corporate hat on for managing these, one needs to be very acutely aware of our demand and supply. Our demand is always going to rise, especially after COVID. It's getting higher and higher. Certainly in our area of mental health, we are seeing far more complexities than ever before, and the impact that it has even in the normal population who now have to seek help through the mental health services as well. So all those things needs to be considered and carefully thought through as well. So I think it's not about blame, it's about planning, that who lies, but the policymakers and the people above really need to think it through. Is it what we're going to be doing and how we're going to be doing? Otherwise we'll end up in this we'll remain in this situation. The other factor is that if what has happened with the Brexit and COVID at the same time is that the workforce going out of the sector, any sector, not just NHS. COVID has an impact about that, where some of your colleagues who may be approaching retirement or have retired and returned to come to work, actually the impact was such that they perhaps thought that, is it really worth carrying on because of the stress that it was imposing on them, because they have much better alternatives as well in terms of they're retired, they have flexibility of working hours as well. They don't have to work 9 to 5 every day as they had done for 30 odd years and served brilliantly the community and the services and the patients as well, excelled, innovate things as well. So they deserve that realistically. So that workforce kind of drifted away as well. We never planned for those things as well.
I agree. It's not just the retiring community of doctors, it is youngsters also. With the post-COVID, we can always blame COVID for these things. The inflation has gone up, but it seems like government is failing to understand the problems the young generation is facing. And when they compare their pay scales with the other countries abroad, there is a huge difference. And I mean, a lot of public now sees NHS as a basically sinking ship, which has been made more complicated because of a lot of youngsters, junior doctors leaving the country to work in other countries like Australia or United States, and so many other countries. Do you think that these problems, as a leader, you have highlighted to government and you have been heard? Because clearly your role as a leader is to bring proposals, put it in front of government, but a lot of times the changes that are required, they are affected so much with bureaucracy, and it's just basically fades when it goes to that level. So is this the kind of situation you face most of the times, or it is just a myth and we think that is the case?
Well, I mean, it's certainly not a myth. It's real. People have options. The world is open to everyone, not just limited to doctors, nurses, or any other professions as well. And then and then the quality of life as well, which is very, very important. The earning versus the quality of life. So when you combine even if it's slightly better earning, but a much better quality of life, what would one choose? Or even if it's the same earning with a lot better quality of life, decision is obvious. Even if it means immigrating to somewhere else, but it all depends what stage in their career and life. Young doctors, yes, because they have an option, because particularly with the changes in the pension system and etc., young doctors would have to work longer. So they have to consider their options as well, that how they want to work, how many hours they want to work, considering they may not be as privileged as me retiring at a certain age. They have to work at least 5 years or more than what I can retire at. So I think that those factors has to be carefully balanced and thought through. And that's where the deficit lies as well. I don't think a very clear thought was given to that. Stage where I am at in my leadership, you can make those cases to your higher leadership and hierarchy and give them the evidence, give them the data, give them the rationale for that as well, so that they can be further taking it up. So it does lies with me for giving those facts, but it lies with my other manager colleagues as well to take it further up into the ICB levels or NHSE level, or even further up at the Department of Health and Social Care level as well. So we need to constantly feed back on that. And one of the things that we are seeing as a result is the strikes, industrial actions, not just by doctors, well, doctors now, junior and even consultants now, and we've seen industrial actions in various other industries as well. So something got to change for it to be stabilized. Otherwise, various ships are at risk of not necessarily, if not sinking, near enough drowning.
So do you think there is hope in NHS that it will get better and people will be more satisfied?
See, hope is a very philosophical way of thinking, and there's obviously a realistic way of thinking as well. It starts with individuals' approaches, that what hope, what ambitions they put in for themselves first, to give them that hope in regards to their career trajectory and projection. Where do you want to go and where do you want to stop as well? And with that hope, you can only build on this. If we remain, the danger here is that we kind of gets into a comfort zone where we are quite happy to be in a very kind of victimized situation where nothing's been done. Okay, I'm not going to do anything either. It's not going to help. It has to change. Realistically, it needs to change. The people needs to up their game. You need to bring change. You need to bring change from within, and hence why I'm very strong advocate of people progressing into the leadership roles and bringing that talent in quite early in their stage as well. I decided to do it rather late in my career. It's a decision that individual needs to think through as well. But if they bring it in an early stages of their career, then you have a longer time to serve and make that change happen, or hopefully see that change happening as well and the impact of it as well.
But you would agree, Dr. Aziz, that when in our generation of clinicians, when we came to this country, we worked very hard and we felt more satisfied. We didn't think much about how much we paid, because whatever we were paid was still better than what we were getting back home. But it seems like the current generation of doctors is more frustrated. So whether it's their expectations are higher or they've got different goals, I mean, I wouldn't say that they're not hardworking, because the challenges they are facing, I don't think we had those kind of challenges. But do you think it's a generation difference that is resulting in how they feel and are ready to even leave the country for a better life?
Well, there's no doubt about is the difference in the generation. I mean, I've come from Pakistan. My children are born and brought up here, so there's a very different way of sort of their upbringing and their thinking as well. We might be an economic migrant, we might be a knowledge-seeking migrant. And I tend to think that it's more the latter than the former, because we came here to seek knowledge, expertise, and develop ourselves so that we do have input back home as well, where we possibly can give. There is no doubt about it that we have worked harder than many other peers at that time who were locally. And it could be for various reasons. One of the reasons could be is that you may have joined into a training scheme or a program later than a normal local candidate would have joined. So there's always years to catch up on that as well, and there's a competition on that as well. So I think that's why we tend to sort of had to work harder than them. And I do think that we are more obliging. We kind of tend to satisfy ourselves with it. Okay, fine, because we tend to multiply the currency into the local currency. Oh, it's better than what I was getting over there as well. It's not. We need to think it what really is here and what the challenge is here. So there is going to be that challenge. And I think the younger generation is quite rightly challenging those ideas and views as well, because I think because they more in tune and more aware of their challenges, because they've got a life ahead of them as well, and they need to address it. So that's a better way of doing it, is to do it now so that they can have a future, better future for everyone. They're not doing just for themselves, it's a collective effort.
Yeah. And as a psychiatrist, what do you see as a nation? What is the mental status of our nation in general? Because we see that mental health issues have gone up. More people are referred with complicated and complex mental health issues now than they were before. Was it because something has changed, or it's just the recognition is more now?
Certainly there is a more recognition. We've still got a long way to go into investing in mental health and bring the parity of esteem for mental health as the acute medicine as well. So there are big difference, and we need to bring this and align it with that in terms of the investment. Recognition certainly is there, but recognition requires investment, and investment has the output as well. So that's the challenge. I'm not a subject matter expert on this, but I can only just talk about a general overview. It varies. Yes, post-COVID impact on mental health is humongous on everyone, not just because of the personal bereavement and losses. There are other losses as well. People have lost their incomes, their jobs, financial stability, and so on and so forth, which has huge impact. But the pockets are different, because inner city challenges are different to outer city. Challenges in south of the country probably very, very different to up north as well. So it has to have a balanced approach as well. So that's why the population health management is very, very important. Is what the population needs are in each and every area, and you invest accordingly to that.
Great. So on a different note, as a leader, the challenges you face, they are different because managers have their expectations, patients' expectations, doctors' expectations. It must be very stressful. So how do you de-stress yourself after a busy day of meetings, which are a lot of them are virtual meetings that we were never used to? So how do you help your own mental health?
Our own sanity. That's very, very important to manage yourself first before you get into the position first. Learn how to manage yourself. Time management is the key in this, is that because leadership or management roles comes with a lot of time commitment. Your day may start earlier than many others and end much later than many others on specific days, not necessarily every day, and possibly being warranted to be somewhere at a very short notice as well. So you need to be aware of those challenges as well. So managing yourself and time management is the key. Without that, you will not survive in this world. There's always a need for keeping some buffer time in between your meetings and others as well, because if something goes wrong or needs your attention, then you have that time as well. The virtual meetings have changed things forever, because I find myself much more busier when I'm doing back-to-back online meetings than as I was traveling between the sites, because don't get the headspace in between or to prepare or think about something else in bed. So it's more stressful just continue to be on virtual world, but we need to adapt to that and have a balanced approach in this. Time management is not about time management at work. How do you manage your time between your personal life and your work life? You can't ignore your personal life. You need to give yourself time. Things that you enjoy doing, must do that. Things that you like to do with other people, family, friends, relatives, children, spouses, you need to make time for that as well. And that's where I find myself doing those things in my extra time, or the time that's away from work as well. Passion. One of the things that I did develop a passion for after coming to this country is cooking. Never ever I thought in my life that I would do the cooking, and according to some people would do such good level of cooking as well. But it helps. I enjoy it, being in the kitchen and cooking for the family or the friends as well. So I love it that time. It takes me away from the whole sort of hassle. It's not the director sitting somewhere. It's Khalid, the father, the husband, the friend, and the family member is there as well. So you need to take those things into equation and have a balanced life. Otherwise, you will stress yourself out. And the worst thing is that you will burn yourself out. And you do not want to burn yourself out, because the impact of burning yourself out is not just on your clinical career or trajectory. It's actually far more worse on your personal life as well. So one has to be very, very careful around that.
Yeah, it's an excellent message coming from an Asian man that you de-stress yourself by cooking. I think there is a huge message there.
All famous cooks are men anyway.
So, as a successful clinician and a leader, what message will you give to our younger generation and those who want to consider taking up leadership roles? How would you encourage them? And so a special message for them, because they're listening?
So I think my advice to them is that think what you really want to achieve in your career pathway. Taking the pathway is very, very important. Do you want to remain as a clinician and progress in that at a consultant level and stop? Or do you want to go into leadership management of this? But there are various things they can do. Research, medical education, and other avenues are there as well, not just necessarily the corporate side of it. But they need to think early in their career if what pathway they need to do, so that they can utilize the resources available to them, the training program, the NHS Leadership Academy, during the training, leadership and management courses, etc. So do it early. That doesn't mean that you have to do it as soon as you take up your first consultant post, but have that experience, knowledge, and skills available to you, so that at that stage when you start. And then set the trajectory. Small steps are very important. You cannot leap into it. That comes with serious risks as well. So set the trajectory, that this is your step 1, that's your step 2, and that's your step 3 and 4. And maybe I want to stop at step 4 and then rethink, reevaluate what I've achieved, where I want to go further. So planning is crucial in that. Very, very crucial.
Thank you very much, Dr. Aziz, for sharing your experience, your journey. And I'm sure this would be an inspiration not only for our younger generation, but a lot of those who are in two minds whether or not they should consider a leadership role. Thank you very much for your time and expertise.
Thank you very much for having me.
So this was Dr. Aziz's journey from being a clinician to a leader in London. I hope you find this inspirational, and I'm sure a lot of you who are watching would take his advice and would consider the career as a leader. while working within the healthcare system. Thank you very much. Goodbye for now. We'll see you next time with another great show. Goodbye until then.